Smooth Health on the Drive.
It's a global observation that helps raise people's awareness.
Insightful tips and information to live in a healthier and happier life.
How to prevent it, detect or treat it.
Smooth Health is powered by Evercare Hospital, Lekki, transforming healthcare in Nigeria.
If you didn't know, now you know.
This is Smooth Health on the Drive.
Smooth 98.1, love music, love life. Welcome. If you just joined us, you're just in time. It's time for Smooth Health. And of course, today we're going to be talking about something very important, like I told you just before the break. We're talking about the myths, misconceptions, and truths about cervical cancer. And of course, like I mentioned, we're having a very special guest to lead us through the conversations on the show today. Of course, joining us live in the studio, we have Dr. Olasupo Orimogunje. He's an obstetrician and gynecologist at Evercare Hospital. Now, Dr. Olasupo Orimogunje currently heads the obstetrics and gynecology department as a consultant obstetrician and gynecologist. He's also a graduate of the College of Medicine, University of Ibadan, and had his initial postgraduate training at the Lagos University Teaching Hospital before moving to the UK, where he practiced obstetrics and gynecology for over 26 years before coming to Evercare Hospital. He is a fellow of the Royal College of Obstetricians and Gynaecologists in the UK and was an honorary lecturer at the University of Lancaster Medical School in Lancaster in the UK. Now, his area of special interest is cervical cancer prevention services, which include colposcopy, and practiced colposcopy for many years while in the UK. Good afternoon, Doctor. Welcome to the show.
Good afternoon.
Good to have you here.
Listeners.
All right, so if you want to be a part of our conversation and you have questions for our doctor today, please send your WhatsApp messages to 0809-444-0981. Let me say that again, 0809-444-0981. Also, you can call the studio number, call the number 01448991 to be a part of this conversation. Like I mentioned at the start of the show, we're talking about the myths, misconceptions, and truths about cervical cancer. So, Doctor, let's just start off with the basics, shall we? Please demystify this disease by telling us what exactly is cervical cancer.
Well, cancer affects almost all organs in the body. The cervix, which is the neck of the womb, is what we're talking about today because it's a very common condition in our environment and worldwide also. The neck of the womb is where the baby comes through. And incidentally, the womb is a very unique organ. The neck is different from the body of the womb, even though they are together. The diseases that affect the neck of the womb is different from the one that affect the body of the womb. So cervical cancer is cancer, as everyone knows, that growth of cells of the neck of the womb that can invade other organs, and if it's not treated, it kills the person. And it's a condition that can be easily prevented. Unfortunately, in Nigeria, that's not happening.
Oh, wow. Well, we hope that our listeners can, learn a few things and they can ask some questions as the show progresses. So there's a myth that the cause of cervical cancer is unknown. So is this true? And also, I'd like to ask you, what causes cervical cancer?
The cause of cervical cancer was not known before, but it's been known for years now. Cervical cancer is actually a sexually transmitted disease caused by a virus called human papilloma virus, or HPV for short. It invades the cervix and then changes the cells to start misbehaving and turn into cancer cells. This virus is transmitted sexually, and if you don't have sex, you are very unlikely to have cervical cancer. But to procreate, we need to have sex. So therefore, it's a condition that is very common because sex is common in society.
All right, thank you so much for that. If you've got questions for our doctor, the number to send your messages to are 0809-444-0981, or better yet, just call the number 0144-89981. So, doctor, some of the myths I've heard about cervical cancer when it comes to people who are at risk of the disease are statements like cervical cancer is hereditary. Some people think that they can have it, or some people also say that cervical cancer only affects elderly women or women who have, multiple sexual partners. So are any of these statements true? And really, though, who is at risk of cervical cancer?
The way we should look at it is every woman that has had sexual intercourse is at risk, because your first encounter having sexual intercourse could give you the human papilloma virus if you're unlucky. But obviously, the more sexual partners you have, the more likely you're going to have it. The other myths are completely wrong. It's not hereditary at all. It's not something that is passed on from parents to their children. It's something you catch by having sexual intercourse. And people who have multiple sexual partners are more prone to have it, because the more sexual activity you have, the more chance you will catch something. But obviously, even if you have one or two episodes of sexual activity, you can still catch it. So everyone needs to be protected.
All right. So let's talk about symptoms. Doctor, when it comes to symptoms of this disease, we've heard some myths, some statements like women with HPV will experience some type of warning symptoms or, of cervical cancer. Could this be the case?
Not really. This disease is unique in the sense that it has a precursor stage, a stage where you do not have cancer yet, but you have a precancerous change in the body.
Okay.
That if we pick out and deal with it, then you don't develop the cancer. So when you're in that precancerous stage, which could last years in some women, you do not have any symptoms. You don't know you have it unless you do screening.
Okay.
And that's why screening is important. Pap smears, so that we can pick that pre-cancer stage up and deal with it before it becomes cancer. But if a woman develops cancer, then the symptoms of cervical cancer comes up, and they can be horrendous, like excessive bleeding, irregular bleeding, excessive vaginal discharge, especially when it's very foul smelling.
Okay.
And then other effects of it spreading into other parts of the body, like the lungs, the liver, like pain in the chest, cough, pain in the tummy, pain in the back if it's spread to the bones. So those are the symptoms of cervical cancer itself. But we do not want you to have these symptoms. We want you to have screening, and then you can prevent having cervical cancer at all.
All right. Thank you so much, Doctor. Doctor, just before we go on a break, I'd like to ask you this. How is cervical cancer diagnosed?
It is easily diagnosed if a woman comes to any doctor, preferably a gynecologist, and has all the symptoms some of the symptoms we outlined earlier, and then they have an examination, especially vaginal examination. If they have developed cervical cancer, it's likely the doctor will see something strange, and then we take a biopsy from that and then send it to the laboratory, and that is confirmed.
Okay.
But we do not want you to come, we do not want you to wait for those symptoms to happen. Come when you are feeling well for smears, so that if you have precancerous stage which does not have any symptom, we pick it out, deal with it, and then you will never develop cervical cancer.
All right, thank you so much for that, Doctor. I like the fact that you want to attack the problem just before it even rears its head at all. But I'm sure that there's some statistics in the world, in Africa, in Nigeria, concerning cervical cancer. But I'm particular about the ones here in Nigeria. So are there some statistics that people should be concerned or aware of?
Yes, it's a cancer that is very common in Nigeria. compared to other parts of the world. In the developed part of the world where prevention services are quite good, cervical cancer has been relegated to the bottom of the pie. It's like the fourth or fifth commonest cancers among women. But in Nigeria, it's the second most common cancer after breast cancer. Breast cancer is the commonest cancer in women in Nigeria and worldwide also. But cervical cancer comes second in Nigeria because we have very poor prevention services. And apart from it being very common, we estimate that there are about 8,000 women in Nigeria that die of cervical cancer every year.
8,000 women
8,000
all across Nigeria.
All across Nigeria. That's an estimate because our statistics are poor. It varies. It can be 8,000, 10,000. So, but it's quite a lot. And that's 22 women every day. That's one woman every hour. Before we finish the program, most likely somebody has died of cervical cancer in Nigeria. 300,000 plus women die of cervical cancer worldwide. 90% of them occur in the developing world, and Nigeria is at the top of that pie, which is really, 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 really bad. And all governments in Nigeria, both federal, both different parties, none of them have taken any significant step in preventing this disease, because it's easily preventable, but because there hasn't been any strong effort from government, it is still very, very common.
All right, thank you so much, Doctor. Like I mentioned, I see a break coming, so I want us to quickly reiterate and go back to the preventive measures that we talked about earlier. Let's quickly talk about the symptoms again, and then talk about ways to diagnose them and prevent cervical cancer.
Yeah, quickly, the symptoms are irregular vaginal bleeding, foul-smelling vaginal discharge, pain, and symptoms of feeling unwell, feeling tired and weak. And those are the symptoms that people get when they have cervical cancer. But we do not want you to have the symptoms before coming. Come before any symptoms arise. And preventive measures,
yes, quickly,
although this is the most important part of this program, I hope we'll be able to dwell on it later on. The first thing is one of the only few cancers in the world where you have vaccines available. You can take a vaccine that prevents it happening. Where in the rest of the world where they're doing this, they have reduced the incidence by at least 80%. And from vaccines to smears, because if you do smears, you can pick up certain changes which can lead to it. If you stop the changes leading to it, then you prevent it. By having smears and colposcopy if necessary, then you can prevent cervical cancer developing. So those are the top two preventive measures. But there are other measures like not having too many sexual partners, using condoms if you're going to do this, which because you are trying to prevent yourself from catching the HPV virus, which causes this disease.
All right, thank you so much, Doctor. Our topic today on the Smooth Health Show, brought to you by Evercare Hospital, is myths, misconceptions, and truths about cervical cancer. And of course, leading us through this conversation is Dr. Olasupo Orimogunje. Stay with us. We'll be back after the short breather. This is Smooth 98.1. Love music, love life.
This is Smooth Health on the Drive.
It's a global observation that helps raise people's awareness.
Smooth Health is powered by Evercare Hospital, Lekki. Transforming healthcare in Nigeria.
To understand Nigeria, you need to appreciate where it came from.
The Federation of Nigeria became independent and assumed the rights and the responsibilities of a sovereign state.
One nation under the oath of democracy, for unity and peace, to be faithful and loyal.
Nigeria is divided into 4 regions: the West, Midwest, East, and North.
How did this melting pot of diverse people become one nation?
We are going to talk about democracy by the people, to the people, for the people. Now listen. My society is underdeveloping because of an alien system on our people.
Let's talk politics and the state of the nation.
So much corruption, commotion, confusion, oppression.
Talk politics, brand new on Smooth 98.1. This July, every Wednesday from 10:15 a.m.
So let's establish a simple truth. The British didn't travel halfway across the world just to spread democracy. Nigeria started off as a business deal for them between a company and a government.
Welcome back. This is Smooth 98.1. Love music, love life. This is the Smooth Health Show. My name is Kylie Baker. Today we're talking about myths, misconceptions, and truths about cervical cancer. And like I told you just before the break, leading us through the conversation is Dr. Olasupo Orimogunje, who is the head of the Obstetrics and Gynaecology Department at Evercare Hospital. Okay, and so far we've been asking a number of questions, and you can also pitch in and add your 2 cents by calling the number 014489981 or just sending WhatsApp messages to 0809-444-0981. So doctor, just before the break we were talking about statistics, and you said we've in Nigeria we base our statistics to 8,000 people, 8,000 deaths a year. It could be more, it could be in between, but I want to talk about something that's just as related to these statistics. Now, going by the statistics that you shared with our listeners, one might say that cervical cancer is fatal. Now, the first question is it fatal? Then, can it be treated and managed?
It can be treated and managed. And for like any cancer, if you present early, it can be cured.
Okay.
Especially, we usually divide cancers into 4 stages. If you present stage 1, stage 2, usually you can be cured. But if you wait till you get to stage 3, stage 4, then treatment is difficult. It might still prolong life, but it might not be curable. But it's not always fatal. If you present on time, it can be treated, which it could be through by doing surgery, by doing radiotherapy, and sometimes we use chemotherapy. And this can cure some people, and those who present late might not be able to get a cure.
All right, so let's talk about prevention. Now, is it preventable? I know we've talked about a series of ways that we can prevent this from happening by coming in early and detecting early, but I mean, is it actually really preventable?
It is preventable because, as we said before, is a condition that is caused by a virus. So if you don't get the virus, then you don't get the disease. And so when we talk about sexual activity, if you limit the number of sexual partners, you reduce your risk of catching the virus. Therefore, you reduce your risk of getting the disease. But if you're unlucky, the first sexual activity could give you the disease. So therefore, we need other measures. And these other measures include, if as a young person, if you get the vaccine, then the vaccine will prevent the virus from taking root and developing, making the changes that lead to cervical cancer. And then the second one will be having smears on a regular basis. At least once every 3 years, every woman should have a smear. And if a smear picks up an abnormality, then you treat the abnormality, and then the cancer does not develop. Cervical cancer is unique in the sense that it has a pre-cancer stage. Most cancers just develop and then that's it. But this one has a pre-cancer stage that sometimes can last years, giving you time to deal with it before it becomes cancer. So you can prevent it by having regular smears and then acting on it if it's abnormal.
All right. Thank you so much for that, doctor. So let's talk about treatments. You've talked about how preventable cervical cancer can be. So are there treatment options that you mentioned? Are there treatment options available for cervical cancer? I also understand that you mentioned vaccines earlier. So are these vaccines available at Evercare Hospital?
It is available. and it's estimated. I can't tell you the cost of it. It looks like it's an expensive vaccine, but when you look at what it does, it prevents you from getting a disease that can cost you millions to treat. So we're looking at something that costs less than 50,000 or something like that. I'm not sure exactly for the full cost of the vaccine. So it's widely available in Nigeria. It's also very much available at Evercare.
All right.
And apart from the vaccines, if somebody develops the condition or the precancerous stage, we have treatment options we can give to prevent it becoming cancer. But if cancer actually develops, then we have the treatment options also available, which includes surgery and then radiotherapy if it is necessary. The early stages can be treated by just surgery alone, and there may not be any need for further additional radiotherapy. But if it's more advanced, then radiotherapy will be options for treatment. And these are all available at Evercare.
Okay, so radiotherapy and then vaccines are measures that we can use to prevent and also treat cervical cancer.
No, the vaccines are good in preventions. The radiotherapy is for treatment of those who have already developed it. So there are two groups now. Those who haven't had it, three groups. Those who haven't had it at all, and those who have had the precancerous stage, and those who have actually had the cancer. Those who haven't had it at all, you can give vaccines, you can take lifestyle measures and avoiding having multiple sexual partners, and those who develop the precancerous stage can be treated by simple surgical processes that you can do and go home straight away. But when somebody has developed it, that's when we talk about major surgery and radiotherapy. So the last part, that's treatment, not prevention.
All right. Thank you so much for that, Doctor. By the way, this is Smooth Health. It's brought to you by Evercare Hospital. If you're out there and you want to be a part of our conversation today, feel free to send your messages in to 0809-444-0981. I'll say that again, 0809-444-0981. And also, you can, call the studio lines. Call the number 0144-89981. Leading us through the conversation is Dr. Olasupo Orimogunje, and so far it's really been quite enlightening, and we'd like for you to add your 2 cents. So here's a message from Ruth. Ruth says, Doctor, good afternoon. Please, I think you already addressed this. So how can the cervical cancer be diagnosed, and what are the symptoms to look out for?
Good afternoon, Ruth. I believe you do not have cervical cancer yet, and hope that is the situation. So you want to prevent it first. So have smears regularly, be vaccinated. But if you have gone to the stage where you already developed cervical cancer, then you need to visit a gynecologist who is subspecialized, because not all gynecologists will deal with this condition, subspecialized in this disease, and then they could offer surgery depending on the stage of the disease, or it might be radiotherapy, and it could be a combination of both.
All right, thank you so much for that. This one from Oladile says, Doctor, how long should a patient wait before they visit a doctor?
You should visit your doctor as soon as you realize there are symptoms of something that you're not sure of. Let the doctor say you are fine, go home. It's better you do that than wait, because your waiting might lead to a disease that becomes more advanced and then more difficult to treat.
All right, thank you so much, Doctor. This one here from Nina says, good afternoon, Kaede and Doctor. Thank you so much for this insightful program. I would like to ask you this. Give us a little... I'm trying to make out what you're trying to say here. Give us a little more insights on how the vaccines work and how effective they are.
Well, vaccines work almost similarly. This particular vaccine was created from the virus itself to create the antigen. The vaccines work by the body creating certain defense mechanisms. That is like you have soldiers, so that if anybody invades your country, you are able to deal with the enemy before they take over the country. So if you have soldiers ready with their weapons, and as soon as the enemy comes, you shoot them down, they're gone. So vaccines create these soldiers in the body. We call them antibodies. And as soon as the antigen, which is the cervical cancer organism, the HPV virus, comes in contact, they kill it before it makes any changes. That's how all vaccines work.
So is it much like how we have, for example, the basic one, the COVID vaccines? So do you need one vaccine, two vaccines, three vaccines? Is there like a method to this?
Yes. There are three. You have to take it 3 times to get a full immunity, because your first dose, we create a familiarization of the antigen with the body, and the defense mechanism will start creating the apparatus to defend against the virus if it comes. And then when you get the second dose, that is boosted, and then the third dose we boost it to a high level so that it's effective. If you ever catch the virus, it gets killed quickly.
All right, thank you so much, Doctor. Doctor, just before I let you leave, though, do you have parting words you'd like to share with our listeners concerning cervical cancer measures, prevention, symptoms, amongst other things?
The most important thing is we have gone beyond the Stone Age, where things are attributed to the certain gods and all that. God has given us this knowledge to know about this disease, and has given us the knowledge to prevent it. Use the knowledge of those God has blessed in dealing with the condition. Don't go to one babalawo somewhere to pray for you, or one pastor praying for you. Go to the doctor and get checked. Take preventive measures, have smears, have vaccines, and if you develop any symptoms, go early to the doctor, because if you catch it and you develop the cancer, because you have not taken vaccines, you have not been doing smears, and we pick it up very early, we can still cure you. You can still be available for your children, because cervical cancer is unique in affecting young women, and these are women, the productive part of the economy. So when a young woman dies, then it affects so many. Affect the husband, the children. It's not like other cancers that tend to affect older people, over 60s, over 70s. At least they've done something with their life. And somebody who's at the age of 30, 35, dying has more devastating economic effects and other effects on the people they left behind and on the country than somebody who is dying over 60. I'm not saying over 60 should die, but
of course,
it has a different kind of effect on the people.
All right, so just before we leave, here's another message from Larba. This one here says, good afternoon, doctor. Can a married couple have cervical cancer? I think you're trying to say, can a married person have cervical cancer? And also, she's saying, how often can you go for pap smear?
Yeah, a married person can have cervical cancer, because it is possible for the virus to exist in a man for years and not have anything showing in them, and they can pass it on to their wife. And it's also possible for a woman, before they got married, before they even knew their partner, to have caught the virus, and it's there in the body. It could be there in the body for sometimes for up to 20 years before it becomes something. And a lot of women are able to clear it naturally, but many women can't. So this is a possibility.
All right. Doctor, thank you so much for coming. I'm sure that our listeners out there would love to contact you at Evercare. So how can the listeners out there reach out to you at Evercare Hospital?
Yes. The numbers to contact 08139850710, or you can go to Evercare website, www.evercare.ng, or you email Evercare info@evercare.ng. And the address of the hospital is number 1 Admiralty Way, Lekki Phase 1, Lekki, Lagos.
All right. Thank you so much, Doctor. It's been a pleasure having you here. It's been quite insightful, and thank you so much for sharing everything with us. Once again, if you're wondering who I've been discussing with, I've been talking to Dr. Olasupo Orimogunje from Evercare Hospital. This has been the Smooth Health Show brought to you by Evercare. Thank you so much, Doctor, once again.
Thank you, and thanks to all our listeners. Thank you.
All right. Lagos, stay with us. There's more to come. In a few more minutes, it will be the Money Minute Show with United Capital. And, of course, after that, it's the Total Football Show on the Smooth Drive.
Smooth Health on the Drive.
It's a global observation that helps raise people's awareness.
Every Thursday at 5:15 p.m.
If you didn't know, now you know.
Powered by Evercare Hospital, Lekki. Transforming healthcare in Nigeria.